Let's start with the vaccinations. There are two sort of like dynamics that are happening right now in this country when we talk about vaccinations. One is that we are on the verge of what appears to be an okay from the FDA for an emergency authorization of the Pfizer vaccine for children between the ages of 16 and 12. It's already between the 18 and 16. Pfizer is the only vaccination that is authorized at this point for anybody under the age of 18. The others are in trials, and you can help us on that. And then the other sort of dynamic is that the demand for shots, at least in the context of the adult population, is waning. Let's take them separately or both, because they're interrelated in terms of the relevance of the former is in some ways more so because of the latter.
Yeah, I would say so. I think this is pretty much an expected course that we would have the highest demand period be early. The people who are really eager to get it and who want to get it right away came out first, and the people who are kind of on the fence, will get it, but maybe can't skip work to get it, or aren't extremely eager, have some hesitation. We're getting into that group now, and so there's a lot of hope that these are people who are just kind of, thinking about it, but will eventually do it. And that's a very different future from if those people are actually quite against it, or if we start to open up these restrictions, we see cases going down, and that actually makes people feel less motivated, like they can be, a freeloader who doesn't even take the time to go get a shot.
How much do we know about the broad cohort of people who have not been vaccinated and are adults? Because it seems to me that there's, and I don't have a sense necessarily of the numbers, but it seems to me there is the I'm never going to take a vaccine. There is the I'm reluctant. And then there's some, I feel like, and I think this is a fairly large number, who either can't get it or it's so difficult for them to get it that they haven't. And I'm speaking of people who can't afford to take the time off from work, who don't have access to the distribution mechanisms that we have. I'm thinking people living in poorer, maybe in more rural areas around the country. I mean, we're definitely seeing a demographic, right? There's some demographic cohorts here. What is your sense of those distinctions, and then we can talk about maybe what we need to do, if there's anything that we do need to do to get shots in their arms?
From my experience, talking to patients for year over year about flu shots, it's rare that someone says, there are just no circumstances under which I would ever consider doing this. And there are certainly those people where they're swearing that you're not going to move the needle. So I don't think there's a lot of point in targeting efforts at that group. Of course, anybody's mind can be changed. I'm not saying give up if you have friends or family who fall in that camp, but I think at a public health level, there's going to be a lot more utility in focusing on people who are kind of on the fence or just been, lead busy lives. This is not their top priority because they have not been that affected by the pandemic or think themselves to be at relatively low risk and believe that everyone around them has gotten vaccinated. For whatever reason, it's not the top of their priority list. But if there were someone who, came and knocked on their door and offered a vaccine, or there were an ice cream truck going around, or it was available at the checkout of their grocery store, and someone was like, please do it. Also, you'll get a $20 coupon for next time you come shop here. They'd roll up their sleeve. And so that's where I think, the media, public health community, government needs to be focusing right now. Once we've exhausted all those measures, where we've really, you really want to get down to the area where the only people who aren't vaccinated are the ones who are actively waving you off and saying, no, it's not, stop offering me a vaccine. I don't want free donuts. I don't want a free upgrade to first class and whatever perks people get. They're actively just saying, no, I definitely don't. And they've said that 10 times.
Yeah. So what, are you aware of moves in that regard? I mean, you're throwing out, it's a half jest, right? I mean, it's not, those measures you're talking about, most of them sound actually pretty reasonable, but I'm not aware, when does the government start doing this? Like, when does you have the government doing, bringing out the carrots? I think there is a fear in the Biden administration that they don't want to really be the ones wielding the sticks because of how polarized this issue has become. But what would be the carrots? And then who brings out the sticks in this scenario? And do you know of any actual concrete proposals that are out there in the public health community or in the governmental circles that would implement it, that these things are being thrown around?
So it's interesting. In other countries, you might have federal policies. I think at the federal level, it would be abnormal even in normal times, but especially during divisive time to impose a heavy penalty. What we do is we limit access to public services, places like schools. You can't work in a hospital if you're not vaccinated, apart from some big medical exemption. Vaccination in schools has always been a hot button issue for a lot of parents, and that's something that's handled at the state level. And there are parents who are willing to homeschool their kids or take them into a private school that might have higher tolerance for exemptions. And there will be state policies like that where they might say, okay, but you can't come into our school system unless you have proof of vaccination. But more likely, we go about this the American way, which is sort of the Krispy Kreme model, where there are private corporations. Either your employer is either requiring it or strongly incentivizing it, and that could be a small thing like you get a paid afternoon off, and that could be in the business's interest because they don't want you missing 2 weeks of work when you come down with COVID-19 next winter. So there's that. And then there are ways that this could be a good, if the Mets want to get their fans back in the stands at full capacity, give them a free vaccine at the game, give them, there are all kinds of reasons this is in the interest of businesses. And that's probably the most American approach, is to have just enough small incentives come that we don't have to have,
We should say the federal government, in my understanding, has in the last relief package, I believe, a tax credit for businesses that give people the day off. I think the day after the shot, or one of those 2 days, you get a tax credit for paying your employee for that day. So we already have at least a federal incentive. And I want to just put a flag what you said about catching COVID next winter. That is something that we're going to talk about in a bit. But let's talk about the other half of it, which is the urgency in getting more adults vaccinated, or I should say the fact that we've reached sort of like the low-hanging fruit when it comes to adults has made the importance of vaccinating children beyond the fact that children can catch COVID. There is increasing data suggesting that they're suffering from long haul COVID, not necessarily in the numbers that like a 50-year-old would, but one that is significant. What do you say to people who are, let's say, nervous about vaccinating their children, right? I know personally, for me, I was like, well, the mRNA, I'll get the mRNA. I'm in my 50s. What happens to me in 25 years? It's not as dramatic. I'm developed as much as I'm going to develop. I'm just degrading at this point in my trajectory. But my 15-year-old daughter, this mRNA, particularly that vaccine, which is the only one going to be available for a 15-year-old over the next couple of months, it seems to me, that's new technology. Hi, I'm Sam Seder. You can watch the rest of this interview and more on our Peacock show, which streams at 5 p.m. weekdays on The Choice from Peacock TV.